obviously we haven't eliminated the virus from Australia. We've done a really good job in limiting the number of cases, but there are still low levels of the virus out there. And the difficulty with this virus is that it can be transmitted when people don't have symptoms or before they show symptoms. So just because you feel well doesn't mean that you don't have coronavirus. And so that part of it does make it very difficult. And we still need to really adhere to that advice that we get about social distancing or physical distancing, even in our family groups.
So this is the big thing, isn't it? And it's easy to feel complacent. Look at the ACT, where I am obviously, and we haven't had any cases of community transmission for a long, long time. You see people relaxing, they're going for a handshake or the peck on the cheek, and it actually feels awkward again now to refuse it. Where do we need to get to? We all thought physical distancing was just this new cultural norm, but apparently it's all been rolled back. I mean, how as a government do you instill that back within people, not just in Victoria, but the rest of the country?
And I think that's right. Hopefully it's a new normal where we're a bit more aware of how diseases are transmitted. And we've seen, it's been very obvious that the measures that we've been using, like the lockdown, the physical distancing, the hand washing, those things have all worked. And it's whether now we can take that into the future, because this virus is going to be with us for a long time until we have a really good vaccine, I would say.
A lot of the research tends towards it being less about infected surfaces. There was so much talk initially it can survive on plastic for 7 or 8 days and so on, but it's actually more about droplets and inside. Does that mean we need to have more of a conversation about wearing masks en masse? Obviously in countries like the USA, where they have really high levels of infection, it's useful to just say to everyone, wear a mask, because wearing a mask is very important if you have coronavirus, so to not spread it to other people. If you are wearing a mask to protect yourself, there are obviously differences with different masks. There's a lot of different masks available at the moment. Some are better than others. So whether they actually protect you or not from getting the virus is another question. In Australia, we're not being told to, because the levels are so low. And as we say, we've been very lucky. And we need to rely on those other measures like hand washing. So we can't forget to wash our hands. We can't forget not to touch our face just because we're wearing a mask. Yeah, and the washing hand things, well, that should, let's be honest, remain forever.
Yes.
Just finally, I think a lot of us have become a little bit, I'm not going to say jaded, but perhaps feeling a bit forlorn about when a vaccine might come along, and the initial excitement at the latest development sort of became, well, I'll just, wake me up when it's here. What's your latest take on where we're at here, whether it happens and the timing of it as well?
Yeah, so there are currently 10 coronavirus vaccines in trials, which is amazing, because usually it takes 10 years to make a vaccine. So things are really, really happening very quickly. There's around 100 different types of vaccines that I know about. So I think we will get one, but we still need to follow those regular steps that we would make sure it's safe, make sure it's effective before we start rolling it out in large numbers. So hopefully, this time next year or even before would be really good.